I've really come to appreciate how important the role of governance is when you have an opportunity to work in different systems. You can appreciate what it takes to transform organizations and how important it is for public health and the delivery system to be connected and to work in unison. We should all be aiming towards a healthcare system that treats people respectfully and understands their lived experiences, their culture, and sees it for the asset that it is. I'm Dr. Sandra R. I'm the president and CEO of the California Healthcare Foundation. I've been in philanthropy for the better part of 20 years, and before that, I had the privilege of being the director of public health for the city and county of San Francisco. I've been the director of the AIDS office during the early days of the HIV epidemic, and a resident and clinician faculty member of UCSF for many years. I think mission comes really fundamentally from values, in particular grandparents, who I spent quite a bit of time with as a young person. They were immigrants from Mexico, no formal education, and they were of very limited means. But the values and the way that my grandparents lived their lives, their whole orientation toward the world was, don't forget where you come from, make the world a better place. Really importantly, get an education. It wasn't until I left Tucson and went to Yale that I recognized that there was this notion of, well, you come from a disadvantaged background. And quite on the contrary, I felt like I came from a family of strong values, of community, of neighbors. And so when I came to San Francisco General from medical school, I felt like I was back in my community at a time in healthcare that was really quite dramatic. And really that was the beginning of what became the HIV/AIDS epidemic. The hospital at that time had an inpatient ward, and there was such an extraordinary esprit de corps about that unit. I'm in my late 20s, pronouncing 2, 3, sometimes 4 or 5 people dead in a night. And it was painful. My brother ended up succumbing to HIV when I was a third-year resident. And so the AIDS epidemic really colored my world, but also working at San Francisco General and the relationship that the hospital had to the health department. It's because of this beautiful connection that I could see between the delivery system and between public health and health policy. Corporations stepped up, communities stepped up, nonprofits came to be. The hospital was the center, really, of what became the San Francisco response to this epidemic. UCSF has always been at the center of what is possible. And you saw it again during COVID, how important it is for public health and the delivery system to be connected. It's taught me a lot, and it's given me opportunities to, I think, make meaningful differences.
Thanks to Medicare and Medicaid, the overt traces of discrimination over race, hospitals became among the most integrated institutions in America.
Today at the California Healthcare Foundation, we work with managed care plans to try to improve health equity, try to help them implement whole person care. What I'm trying to promote now are younger leaders to be able to see in themselves that they too have a role to play. And so my hope is that those leaders and the governing boards around them understand how important it is to build and sustain trust in our institutions. And in healthcare, very few people can argue that healthcare is not important. The people at UCSF have at their core, on the whole, a deep sense of how important healthcare is in lifting up a community. And UCSF and San Francisco General really, for me, provided many opportunities to solve problems and make the world a better place.